Hi everyone. So today we're going to continue the conversation about mental health. I did a video earlier. My friend Farhana picked it up and did a wonderful, very honest and real conversation about her own struggles with it. So let's continue the conversation. I just got home. I'm exhausted. It's been a long day, but I'm so pumped and definitely want to respond to some of the comments that I've been getting, some text messages I've been receiving, and also wanted to talk a little bit more about, just the issue. So let's start with, I did the describing depression and anxiety, okay? Did it as briefly as I could. Let's talk about the difference between the benefits of medication, and therapy. What is the difference? Which one should you do? So here's the deal. Working in the psychiatric field and seeing mental health as closely as I have professionally for the past, 4+ years that I've been working in the field, but I've been working with addicts in recovery for about 20 years now. I've been working in mental health in the social service field since '95. So my experience has been not just personal, but also professional. And here's what I have to say about that. I don't think that you can completely discount medication. I think there's some people who absolutely benefit from it, and some people who absolutely don't need it. But I think that even those who benefit from it, I agree with my friend Farhana that you need to not just if you are going to take the medication, you actually need to get to the core issues of why these symptoms are coming up, right? So why are you feeling sad? Why are you frustrated? What is this deep, anxiety? What is this coming from? Like Farhana mentioned, I also, as much as I loved my ex-husband and, I was happy, I had a chemical imbalance. I had stuff going on, memories from my childhood that, I was struggling with that came up, issues of abuse and again, no one's to be blamed. This is not a reflection on my family by any means at all. I grew up in a wonderful, loving, incredible family, and I continue to have amazing family support. I think life just happens, right? And so I think it's important to get to the root cause of whatever it is that's causing the depression or the anxiety. A lot of times it can be addressed, like I've said, through different modes of therapy. Traditional talk therapy is effective, very effective. It just takes a long time. I tend to be a little impatient, and just recently, in the last, 3 years, 4 years since I've come to learn about other modes of therapy that are more effective, I use it. I've used it for myself. I've used it for my loved ones. I've sent my friends and family to my favorite, counselor, a therapist she's a hypnotherapist herself. I personally am finishing up my training with her. And in that, just, with organically, life has brought me to different healing modalities that now I utilize in my private practice with my patients. But that doesn't mean that, you have to do it. You have to do the alternative stuff. No, traditional talk therapy is very effective. And again, please, just find a local therapist. There's a lot of good people doing a lot of good work. Get a recommendation and go try it out. If you don't like something, if you don't connect with them, ask yourself a couple of questions, right? Sometimes when the therapist is good and they hold us accountable, we don't want to deal with it. And so we blame them and we call them, they're not a good therapist. Sometimes we just don't connect with them, which is fine. So I would say give a therapist at least 3 to 4 sessions before you say no. And be honest and be real and get in there and get ready to work on your stuff. Because again, working on your mental health is a spiritual process, I believe. Because when you start to address these core things that have happened to you, those have all happened to teach us something so that we can learn the lessons we need to learn so that our soul can evolve and grow. And so let's not waste those opportunities. But I don't think that we should, just take the medication. I think you have to have therapy with it. And in the process of therapy, if you're able to then address and get to the core issues and then you don't need the medication, by all means, work with a psychiatrist, work with your physician to, wean yourself off it. But I would not say don't take medication, just do therapy. I would not say that. Yes, meditation, mindfulness is absolutely vital, absolutely crucial. And I'll tell you, I was a fake myself. I used to do meditation in my little private office with my clients. I would make them do it. But I never did a practice on my own until this year. And until I started doing it this year is when I literally felt the shift within myself. This year has been a very powerful year for me. And those who are nearest and closest to me are witnessing that for me because, again, I'm still in the cocoon stages of it. So that's that. Anyways, in terms of what's the difference between a psychiatrist and a psychologist? Well, a psychiatrist is a medical doctor who goes to medical school and specializes in not just the physical health and regular health, but specifically in mental health and psychiatric illnesses. So they are trained to address mental health with medication. So really, I'm reading Nivea's comment. I agree, the therapy and connecting with your therapist and addressing the problem. Life gets better. Then thank you for these talks you offer us, and God bless you. Thank you, Nivea. So a psychiatrist is someone that will be able to write you the prescription. A psychologist is someone that's trained as a therapist, and they do the talk therapy. But it's not just a psychologist, right? It's a licensed clinical social worker like myself. It is a clinician. A clinician is anyone that can do clinical work with a client, with a patient. A mental health therapist, a marriage and family therapist. There's many of us that are called different things. Sometimes we're called counselors. Many of us that are called different things are still all trained and more than qualified and able to help you with mental health issues. And I'll tell you, I work in this field. Some of my closest friends are, we all do this. And we work with all kinds of people that come in, right? All kinds of people. There's literally, it's like the stereotypical idea of, somebody might have anxiety and somebody might not, and somebody's dealing with depression, somebody's not, and they have bipolar. You really don't know when you're looking at a person what they're dealing with. And you can't tell, and people do a really good job of hiding it. So again, let's stop the judgment, and let's open up the conversation and let's talk about it. What is the big deal in saying, yes, I had an anxiety episode, and then give them space and educate yourself to then learn about what that means. Now, I personally have not experienced anxiety in a clinical sense. Sure, I've had an episode here or there over the last maybe 20 years, but my issue is depression. I know that that's something that, not recently, but I have had issues with depression, again, being in a, relationship where I didn't feel fulfilled, feeling like I wasn't living my authentic truth. It contributed to the depression that was in my marriage. And again, there's no judgment. I'm on excellent terms with my ex-husband. I have nothing but love for him. He did the best he could, in the marriage. We continue to co-parent. He was the biggest teacher for me, and he provided a lot of sort of safety and comfort in the harshness of the divorce that it was. That was years ago. It's all said and done. There's no, it took years to heal, but we're in a good place now. But the point is, there's nothing to be shameful about. There's nothing to be embarrassed about, because if anyone judges me for the fact that I live with depression, the fact that I was on medication, and if I need to be, I might be on medication, the fact that I was sexually molested, the fact that, whatever, I'm short and I'm brown and I'm chubby and, whatever, I'm flawed, right? If anybody judges me on that, then that's on you. That's on them, right? then you miss out on everything else, all the other beautiful things that I bring to the table. Okay, and mental health is just one part of it. It has informed who I am. It has allowed me to, do the work I do. The sexual abuse has allowed me to be in a session with a client and intuitively know what I'm dealing with. And because I processed my own pain through different modes of therapy, I'm then able to help heal other people and help them get past it. So for me, everything that I've experienced has been a blessing. And, it's painful in the moment. Absolutely. I get it. But I think it's also changing the perspective, changing how we view it, changes the game completely. So I can sit here and feel sorry about it. I can sit here and feel sorry for myself, and I can sit here and feel dirty and shameful about it. Or I can say, Shukar Mola, thank God I went through this experience, as painful as it was. It provided me an opportunity to learn, so I move on, right? Again, learn it, use it in that light, and get the help you need. And, something I tell my clients all the time who have a lot of shame about, and this, it doesn't matter if you're, brown or if you're black, it doesn't matter what community you come from, the stigma is there regardless. People don't need to know your personal business. It's, yes, talk about it if you're comfortable. But until you're comfortable, nobody needs to know you're going and seeing a psychiatrist. Nobody needs to know you're on medication. Nobody needs to know you're going to see a therapist. You can just say, I'm in a meeting, or you can just say, I'm going to the doctor. It's nobody's business what you're doing until you're comfortable sharing. And at the end of the day, if you're not comfortable, then don't share, but get the help you need, because life is too beautiful to suffer alone. There's no reason to suffer through this when there is help. There are resources out there. So again, yes, I'm a professional in the field. Please use me, inbox me, message me. I'll be happy to get on the phone to talk to you, and Google local therapists, Google local psychiatrists, talk to your church pastors, reach out to your doctors and your psychiatrists and, your therapist, and, ask people, start the conversations around the dinner table. Anger shows up. Depression in men shows up as anger, just FYI quickly, and that might warrant a whole nother talk. In women, we tend to do sadness and whatnot, but in men, it shows up as anger. In teenagers, it shows up as anger. So just, the root cause of all of that is pain and fear, right? And the root cause of the happy emotions is love and joy. Anyways, I hope this was helpful. Thank you so much, and God bless. And let's continue the conversation. Thank you.